I have had a pretty rough summer pain-wise. I hope you are experiencing some pain-free days. But I've had several flare-ups that have lasted anywhere from my usual 3 days to as many as 6 days or more. Around the 4th of July, I made deviled eggs, and I literally had trouble walking for 6 days from doing that. So it doesn't take a whole lot to set me off. I've been having trouble with my feet. I had messed up my left ankle getting up off of a low toilet, and I've been in physical therapy for that. And the physical therapy has set off more problems, including severe leg cramps at night and putting me back in a boot for many days this summer. Then I started having trouble with my right foot, and I had it x-rayed, and some of the cartilage in the top of the foot is gone between two little bones, and it is also having arthritis. So when I would walk on my right foot, it would feel like it was breaking. I had days I would walk on my left foot, it would feel like it was breaking. And I have a boot that I've been switching between the two that I bought off of Amazon. And I have a couple of braces that I've been wearing on the lower pain days. So I haven't got as much done this summer as I wanted to, because it seems like every time I start to do something else happens and I start having some pain in a different area. And honestly, it's hard to do much when one or both of your feet are not cooperating. I travel with a cane in my car. I travel with a crutch in my car. I have a boot that I keep right here. And there's been times I've had to have my husband like go upstairs and get the boot or go to my car and get the boot because I literally can't walk to go get my boot. So that is what's been going on this summer. I had a DEXA screen to see if my bones were still in good shape since I've had so many issues. Under the age of 65, they were suspecting that maybe I was having some issues there, but everything looks pretty normal there. I think a lot of my problems are stemming from my nerve damage that I got from an epidural where he punctured my spinal cord in July of 2021. I've been battling a lot of issues since then, and this year seems to be worse than last year. I haven't been able to do the gardening that I did even in above ground pots like I did last year, and I've just been able to do things as I feel like I can. So I've really been kind of lazy this summer. I've had to really take a step back for my health and take a step back so that I can listen to my body on the days that it doesn't feel like it can do much. I usually do a small task in the morning of about 5 minutes and maybe one in the afternoon of about 10. Sometimes even those can set me off. So I hope that your summer is going better than mine has been. I'm still trying to keep a positive attitude because I'm still upright. I'm still moving. I am not letting this get the best of me. And I remind myself of that every single day. Things could be much worse. I could be in a wheelchair. I could be where I can't walk at all ever. I could be where I couldn't drive. And driving is causing me a lot more pain. Even though I keep that acupressure pillow in my car, I've noticed over the last couple of months that even short distances are causing me a lot more back pain. Now, my physical therapy set me off the other day. They had me sit in a chair and just try to lift each leg like I was marching. I cannot lift each leg more than about an inch off of the floor, which she said was fine. But every time I lifted that leg, either one, I felt horrible pain in my back and it started to seize up my right side. And I told her that I didn't think I could do that. She wanted me to do 10 on each side. By the next morning, I was back in the pain clinic getting lidocaine shots in my back. And this time they gave them to me in the femoral cavity. I hope I said that right. It's right between like where your thigh and your pelvis is at, right in that crease. They have you lay on your back, which is hard for me. Put your knee at a V on a little bolster. They use an ultrasound to see where they can poke you so they don't hit a nerve or a muscle and put it right there, kind of, right there. Yeah. And I had a bruise on the left side, and the right side was okay, but I felt the one on the left side for a couple of days. But it did help my hip pain. I was having immense hip pain, and many times hip pain comes from the back, from bulging discs or herniated discs, and that's where my pain had originally started back before I got that epidural that did so much damage. Is I was having left hip pain, but nothing was wrong with my hip. It was coming from my back. My father-in-law also had the same thing. A lot of hip pain, but it was coming from a herniated disc in his back. So I don't pretend to know a lot about some of the stuff, but I know what I've experienced and I know what I've dealt with, and I know the results of some of the things they have me do, like in physical therapy. I woke up with immense leg cramps in the shins of both of my legs at the same time after she just had me do gentle stretches where I put my feet on the ground and lifted the big toe on each foot. When I started, I couldn't even lift the big toe on my left foot. That's how bad my feet were. And she wanted me to lift the four toes on both feet without lifting the big toe. I can't do that at all. I can't do it at all. They don't even move. So I was practicing lifting that big toe, and then I woke up in the middle of the night with immense leg cramps, and the big toe were sticking up on both feet and horrible, horrible cramps. I would push the big toe down, I would rub out the cramp. Thankfully, it went away. I've had cramps before that don't go away for like 3 days, and I was terrified that physical therapy would start that. It seems like each thing I've done each week has had some sort of adverse reaction. And when I go back the next week, she said, yeah, we're not doing that exercise anymore. In fact, my orthopedic doctor wanted me to go 3 times a week. And the therapist said, no, with your conditions, let's go once a week. Let's see how we do. And each week I've had reactions to whatever tiny little movement she has had me try. So that's how my summer has been going. I just want to check in with you guys. How is your summer going? How are you doing? How are you feeling? How is your pain level? Let me know in the comments below, and I look forward to chatting with you.